With the regular focus on the global spread of coronavirus over the past 18 months, this presentation is going to address some of the issues with hotel quarantine in Australia. With nearly 4 million dead, the coronavirus has spread to nearly all parts of the world. By the end of last month, there had been over 666,000 deaths in the United States alone. There have been over 180 million cases globally and nearly 4 million deaths, giving a percentage of positive cases resulting in death of 2.17%. The hardest hit countries in raw cumulative deaths by the end of last month have been the United States, Brazil, India, Mexico, and Peru. Governments are taking a wide range of measures to tackle the COVID-19 outbreak. The Blavatnik School of Government at the University of Oxford works to track and compare these government responses to the coronavirus. Information on which measures governments take and when can help us understand the responses in a consistent way, aiding efforts to fight the pandemic. The data is collected from publicly available information by a cross-disciplinary Oxford University team of academics and students. The first 7 indicators, C1 to C7, evaluating policies such as school closures, travel bans, etc., are recorded on an ordinal scale. The remainder are financial indicators such as fiscal or monetary measures. There is a working paper describing all the various data sources on their site. Later versions now include vaccine prioritisation, availability, and financial support to get vaccinated. The figures in the chart on the right are for Australia on the 11th of July 2021, giving a stringency index of 68.57. While Australia has avoided the major implications of the pandemic due to our island status, we haven't been completely immune. Across Australia, there have been 910 deaths from 30,457 positive cases as at the end of last month, giving a percentage of positive cases resulting in death of 2.98%. Victoria has taken the brunt of this pandemic so far, though, due to its smaller number of cases, Tasmania has a higher percentage of them dying. There isn't a complete list of hotel quarantines, as not all states choose to publish them. I've put together this partial list with their occupancy numbers. Most of our outbreaks have originated in hotel quarantine, with all states except Tasmania and the Territories having had outbreaks. While New South Wales has had the most failures, Victoria has had the most per 100,000 travellers. The Australian Bureau of Statistics started releasing a range of products and data sets to assist economists and academics in understanding the economic costs. While not all industries have been similarly impacted, this is predicted to get worse across the board. Some of the main points from the previous slide and the ABS survey are that the impact is mostly from reduced local demand. Also, while professional scientists and tech services have been the least hurt so far, that impact is predicted to grow from 21% to 78% in the next year. The federal government has already allocated $66 billion in last year's budget. This is now being supplemented by new disaster relief payments. Then there's the cost of paying the hotels for permanent occupancy availability. New South Wales is currently planning some packages of their own. Given the high costs, the lack of cohesion across the states, and the proneness of failure of hotel-run quarantine, this report recommends a federal government-run dedicated quarantine facility would improve on many of the shortcomings of hotel quarantine due to the potential for an economy of scale, bargaining agreements, and a better overarching organisation. The federal government should create, fund and run end-to-end quarantine facilities in each state. Information on the quarantine program should be easily accessible to travellers on federal and state websites so that they can understand the requirements and be properly prepared. The travellers should have timely access to decisions, reviews and complaints mechanism with an escalation option. The option of travel bubbles should also be considered for appropriate groups such as those from New Zealand. Thank you for listening.